podcast where we explore what's really moving healthcare forward in today's environment. My name is Stephanie Dorwart, and I am the CEO of Altius, and today I am honored to welcome Kevin Dady to the podcast. He's the Managing Director and Healthcare Practice Leader of Centri Business Consulting, and he currently also serves as the President of our local HFMA Pennsylvania chapter, which is how we became acquainted. Kevin, welcome to the show.
Oh, thank you, Stephanie. I appreciate it. That is such kind words from you. I really appreciate it.
Yes, it's great to have you on the show. So as, one of the leaders of Centri's healthcare practice, what are you seeing right now and what are some of the most significant healthcare challenges that you're seeing your clients facing?
Yeah, I think it's interesting. I think there's just a lot of uncertainty right now. I think it's the, regulatory environment and the issues with extending, some of the ACH or ACA extenders and other types of things that are causing a lot of consternation in just that, will be more people not having insurance now if they don't have those, those amounts to come in and help out with that. So there's a lot of just, I think, uncertainty right now in the healthcare space. And then in addition, I mean, we'll get into a lot of different things today, but I think there's just issues with, financial discipline. How do you keep operations going? How do you make them better within today's environment? Interest rates are still high. Inflation is still high, no matter what is being said. There is actual, price increases still for medical supplies. Addition, we'll get into probably a lot with the cost of staffing and issues that are still coming from that. And you'll see too that it's keeping a lot of the healthcare executives up at night is how are we going to keep staffing our facilities? How are we going to keep taking care of our patients in this kind of environment? But again, there's a lot that's going on. I think there's issues with coverages. I think rural healthcare is going to be a big topic as well too. Is how do you cover the entire populations?
Yeah, the rural market definitely, I think, is something for all of us to really pay attention to moving into 2026, not just because of, the rural health, funds that are going to be allocated out to those organizations, but really about, what does rural healthcare look like, especially with the Medicaid changes that are occurring in the patient population. And to your point, Kevin, there's going to need to be more collaboration. There's going to be more activity with mergers and acquisitions. And in many cases, there's going to be shifting and changing about what are these healthcare organizations truly going to focus on. And with that in mind, what we're seeing a lot of, and you mentioned it with the salary escalation and workforce shortages, it's becoming harder and harder for healthcare leaders and executives to balance putting out the short-term fires. I've had clients recently refer to their day-to-day operations as dumpster fires, which I thought was interesting. So how do they balance the short-term operational pressures that they go through on a day in and day out basis with the longer-term needs? I would say when I came into this field, over 20 years ago, strategic planning was a discipline that everyone was in, and your 3 to 5 year plan could stay pretty solid. Now I find that it doesn't even work for a day. So how do they really balance the short term with the long term?
No, that's a great question. I think that's even from a short term, the budgeting process. By the time you get the budget done, it's not even relevant anymore. There's all the different things. So I've kind of looked and suggested that people get more into a dynamic kind of modeling of budgeting and just kind of doing 3 months at a time, reforecasting and kind of, live and going through it. It just doesn't seem that there's, a lot of return on the investment of people's time to spend that much time going through this when things change all the time. So I try to recommend to my clients and my firm, we do kind of a lot of FP&A type consulting as well too for our clients, large healthcare systems and also smaller startups in the private equity backed space. So that we try to help them be more nimble in what they're looking at, be able to react in real time to various changes as they come on. But from a strategic perspective, you're right. I think it's got to be that you've got to stay on top of it. I think a lot of issues too with some of the kind of the standard kind of community hospitals or the smaller systems are the boards, and the boards are a lot of times stuck in ways that take forever to make decisions and feel like they have a lot of connections to the community and responsibility instead of being able to say we got to make changes quicker. We got to be able to look at the strategic plans and what's going to happen here. We can't just think, well, it'll get better in 10 years or 5 years. and really get people to get the buy-in. And that's one of the barriers I've seen a lot, especially in our area in Pennsylvania. A lot of just slow moving, slow reactions to what's happening instead of looking and saying, hey, we've got 5 years left. We got to start talking about it now. How are we going to find a strategic partner? How are we going to find some other joint ventures or other ways to be able to have financial sustainability?
Yeah, I really see the decision-making speed as an area of opportunity for our clients and
Oh
healthcare
yeah,
organizations across the country. The rate at which decisions are made in our environments as
yeah,
we think through, innovation, where healthcare is going and what we're going to need, there's so much speed coming at us in the industry and change, and our decision-making time frame needs to really keep up with that. And
absolutely.
I also love what you said about the budgets. I used to joke that your budget is only, good on day one, but now I'm not even sure if it's good on second one of day
Yeah,
one,
yeah,
because soon as it's right out of the gate, the fixed budget does not really serve us any longer. And I love what you said, Kevin, about really getting to that dynamic update so that you're updating your staffing needs, your volume needs, your, resources in line with what's actually occurring day in and day out. So you're focused on that dynamic shifting change.
yeah,
So you're working across a lot of public accounting. You work with, a lot of interim CFOs roles, joint venture capitalists, healthcare advisory. Where does leadership fit into the mix? And how does leadership really support organizations and executives as they're working to make better operational and financial decision making? What should people focus on when you're talking about leadership?
yeah. I think it's really kind of that financial discipline, really making sure you're spending, the money in the right way. And one of the things that I've seen in my years is a lot of times when you're dealing in patient care and you're dealing with healthcare providers, is kind of some of the finance, some of the analytics being kind of pushed to the back. Accounting system or a new patient accounting system or something to even like productivity, like what you guys do as well, is the data that can be available is very helpful to be more nimble, to be more fiscally disciplined as well. And they could track supplies and making sure that they had no one knew what was on hand. And I think sometimes that it's hard to convince a board or other non-finance people that it's really critical to have updated systems so you can make decisions in real time and not have those kind of issues. So really having the right information to be able to make decisions, I think, is key to being a strong leader and being able to provide to the board, to the C level, that you got to make the decisions based on the right data, not just, oh well, we're not sure what this looks like, we don't know, we have. Really getting to real-time data, having the information available, and really that way you can balance out with your limited financial resources, where they go and what makes sense and what areas that you focus
Absolutely. The availability of data and the access to information is so important in day to day operations. And we see it all the time. And it's becoming more important, even with regulatory requirements, to justify, do you have the right staffing ratios? Are you utilizing that?
on. Mhm.
And in many cases, we have clients that have position control sheets that have been put in place for the last 10 years and haven't been updated. So it's really important to
Yeah,
focus on that. We have clients that use benchmarks that that they looked at them 5 years ago, and I think we can all agree that things change in healthcare and they change
absolutely.
pretty rapidly. So updating your targets and your benchmarks and your key performance indicators and your dashboards on a consistent basis and then tracking it in real time is going to become more and more important. Now,
Yeah,
Kevin, we talked about all the organizations that you're supporting and we talked about the priorities, and they're all over the place. And I know you do a lot of advisory service and a lot of assessments and, working with organizations as they're looking at where are their gaps, what do they need to change, where do they need to improve. When you're talking to your clients, how do you help them really determine what they need to focus on? If I'm a hospital executive or a leader and I have 55 things that are my current priorities, how do I know what I need to focus on today, this month, this quarter, this year?
that's a great question. And really, from my perspective, it's just listening. I try, even though I've been known to be a person who talks a lot, I try to really listen to my clients and really hear what they're saying to be able to figure out, okay, what's noise and what is actually the big issues that they're dealing with. And then being able to help them, find the resources to do that. And a lot of times, it's my firm can help with certain things, but also sometimes I have to help them find other partners. So we really, try to figure out how we can help them and how our other referral sources can help them, and really bringing that solution to the CFO is, what we try to do, but really just listening in and saying, okay, well, I hear what you're saying about this, but maybe you need to take a step back, like we talked about before, figuring out, getting the data first. Where's that data at to support that before you can make decisions? Say, well, what should we do? Should we, close this unit? Should we, go in a different direction? Should we look at maybe doing a joint venture with surgery center? But you got to have the information first to be able to do that. So a lot of times just trying to help them, figure out what they need to make the decision before making the decision. So, we try to help out in a lot of ways. And, with that too, is taking some of the burden off of other things they're doing. The key is getting those monthly closes done quicker so you can make decisions quicker. I've seen a lot of places where I've gone into it, it takes them, 30 days to close the books, and that doesn't work anymore. You've got to have it so you can get the information quicker, get the KPIs out there, look at trends, start looking and seeing where there's issues at so you can kind of track this down. We've seen that with clients where we've been able to identify, once they've got their books closed, we found issues with some billings that weren't being done correctly, and helping them understand that and refocusing the resources to say, let's track down this issue in the billing system. Don't worry about the other things. We'll take care of that for the auditor. We'll take care of this, and really help them from that perspective.
We would never get into our cars and drive for the first 3 hours and then turn our GPS on to see if we're going towards our location. We're going to get into the car, hit the destination right away, plug it in, and then go towards that destination. If you wait 30 days into the month to actually close your books and know where you are, it's already too late.
Absolutely. Yeah.
You have no way of course correcting. And the other thing that I was thinking about as you were talking about, external partners and what Centri does, for clients as you come in, is I had a mentor early on in my consulting career say that there are really three reasons you hire external resources. One is because they have the knowledge and expertise that you need that you don't have. Two, they can help you do something a lot faster. So I heard you mention speed. So if someone has that expertise, they can come in and do it a lot faster than you can learn that skill. So bringing, a partner in to speed up the process is extremely valuable. And then the third is that sometimes you need a different person to deliver the message. And
Yeah,
I heard
absolutely.
that in what you were saying as well, is sometimes someone has to be able to listen to all of the feedback, all of the noise, all of the reports, and share the information from a different perspective. And we're seeing a trend right now with our healthcare clients and with the healthcare industry. And I'm not sure if you're seeing the same thing, where there's a lot more acceptance of that short-term fit and bringing in external partners in a variety of different areas instead of adding permanent staff members to the organization. So really understanding, what do we need right now? What do we need currently? And how can we support it with external resources? Kevin, how do you really see that model supporting, what's happening within healthcare right now, whether it's staffing effectiveness, financial results, operational results, or even just the flexibility and the need for speed that we've been talking about?
Yeah, it's interesting. I've seen a lot of, and I've known over the years as especially in our area, Western Pennsylvania, the healthcare leaders have been here for years and years, especially even the people in the reimbursement departments, in business offices, and they're not getting any younger. I see this when I go to my HFMA events. No offense to all the great people in the room who have a ton of experience, but they're retiring, and there's not a lot of people behind them who know cost reports, who know the the details of reimbursement, who look at all the regulations. And there's definitely a lot more, I think, risk now for that. And I know a lot of providers are going out finding the expertise, and basically some of the firms have that lab. I don't do cost reports, my firm doesn't, but we know a lot of great firms that do that work, so we can refer that out and say, hey, you're not going to be able to find a person to do this anymore. How about you just take out the cost report prep to another firm? That way you take all this time out, you're going to pay for it, and you're going to get better results because they know the latest information, they have the latest software tools, they have all when they're doing it on that kind of basis, it's pretty cost effective. So that's one of the things that keeps coming up when I'm out there is they just don't have people that understand that kind of, really detailed expertise that people need in those areas.
Yeah, we're hearing that so much more in today's environment, and there's so many more shortages of resources that actually have the skill sets, to your point, Kevin, that using, some external resources for the cost report can really help you increase your
Mhm.
reimbursement rates.
Absolutely, too.
There's
Yeah.
things that you may not even think about that you can change one little piece of the cost report, and all of a sudden your reimbursement per case, your reimbursement per patient day, whatever is it might go up just a little bit. And that's extremely important, especially
Absolutely.
in the critical access environment.
Right. And all the things we're talking about from, all the financial issues and trying to be, a lot of focus on, margins again and trying to come back from that is that opportunity to find additional reimbursement, to find additional ways to be creative in, different ways. Everything is complex and, a lot of times you don't have that kind of, expertise in house, especially the smaller systems. And so I really try to recommend too that, the consideration be done that is as people are retiring, or maybe you can even find better opportunities for use of their time than doing that.
Absolutely.
But
So
there's
now I'd
also
love,
other, I mean, there's other opportunities as well too. Not even just that perspective is that getting people in just to do certain things like internal audit outsource, co-source. One of the things that I've seen for over the years, many years in healthcare, being part of public accounting and consulting, is there are other areas that you can focus in on for efficiencies and doing some of these internal audit projects and finding a partner. Something my firm does is that come in and do just some internal audit projects, a couple of projects a year instead of having a full time internal audit department with different kind of skill sets. You could bring a skill set in to do something in the IT area or the cyber area. I mean, cyber risk is unbelievably getting more and more prevalent now too. I've had clients that have had their medical records locked down, their systems locked down, and had to pay ransom and whatnot too. So there's a lot of things to consider too. And I know that a lot of the healthcare providers say we have a limited budget, we can only spend so much, but some of these things are, I think, worthwhile when you think in the long term. There's a lot of risk out there that you need to consider, and a lot of the in-house people don't really have that skill set to do those certain things and to get involved in some of the IT things that are happening these days.
I also find that it's very cost effective to move your organization into a constant state of readiness in all of those situations. When you're talking about, the audit piece, it's better to be constantly ready for the audit. And it will take a lot less resources and be a lot more cost effective to be ready all the time. And we
Yeah.
find that with accreditation and, Joint
Mm.
Commission or
Yeah.
any of those, where hospitals that wait until a couple months before end up paying a lot of money to build out what they need in the policies and procedures. Where if you're just always ready and that's a constant discipline that you have, you're not spending as much money to actually be in that constant state of preparedness. And I find that, with the audit piece too, just
Yeah.
staying on top of it, having your productivity system in place, updating your targets consistently, that's much more cost effective than only doing it once every 5 years or once every 10
Absolutely.
years. Also gives you the ability to create momentum.
Yes. Absolutely. Absolutely.
So if we're looking ahead 2026, 2027 down the road, I wish I would have a crystal ball, and I know everyone wants to have that. But if you could predict, moving out beyond just the regulation things that we've already talked
Yeah.
about, what trends are emerging? What are we going to be hearing more about in 2026 and beyond
Yeah.
from your perspective, Kevin?
This is the interesting, I think, part of this. I think, you've got a lot of AI coming down the pike. I mean, still we're in the early stages, but where are we in this whole AI issue? Where does it come into play with right now it's more in just the data and getting through data and sorting data and helping out with, basically physicians being able to dictate notes and do all that. There's a lot of different ways right now. Some of the case management, some of those areas, it's all in the data area right now. But when it gets into something like with the insurance companies deciding patient care, doing, are they going to be doing, denials based on AI? What is going to happen in that area? So I think there's this, issue with governance is going to be a big, big topic with AI, especially in the healthcare space, is what kind of policies do you have? What do you have out there to be able to have, making the right decisions? How does it impact it? What is the governance you have on that and over your organization? I think there's a lot of risk there, and there's opportunity with AI in various, perspectives. I've heard some physicians speak recently about, you know, using it for certain areas, for maybe suggesting a certain path for patient care, but not actually doing the procedure or being, assisted with that. So I know there's a lot of ethical concerns as well too, but AI and governance, I think, is going to be a big issue over the next couple of years. Is, there seems to be a massive push now kind of for AI, and to also with regulations. We can probably have a couple other podcasts on other topics, but I think that's going to, be a big issue. Again, I think we've talked about, where does this go from here? I know, a lot of times where it's been an issue is, hospitals at home. How do you get the patients out of the hospital, out of facilities, back to the home? And how would that occur given labor shortages? And he brought up a great point, because another issue is the crisis in long-term care and the issues with consolidations in that space, bankruptcies in that space, even more so than other ones. And that could open up a whole new discussion for us on private equity within, certain, patient care and that as well too. But, really, how does the care get out of these facilities and back to the home? I don't think we're prepared for that yet. You need a cultural shift, plus, availability of, people's time, and also to be able to have the wherewithal to care and be able to pay for it, who's going to pay for it as well too. I think you'll see still more mergers coming through. I think it's really going to be, it's the independents aren't going to really, I don't think, be here that much longer. And we saw that here in Western PA. It took a little time, but we've had so many consolidations again over the last couple of years after the initial wave, UPMC and AHN Highmark. And now you see, W Medicine coming into the market now with the, consolidation with the independents, which was just consolidated from Butler and Excella. So you've got a lot of catch up that's been happening, and kind of rapid consolidation here. All things kind of, we kind of take our time with trends and whatnot here. That's interesting, but I think it's going to keep on going, because like we talked about earlier, is the rural healthcare is going to have to, someone's going to have to manage and direct that. I think technology can help with that, maybe loosening some of the telemedicine type laws that, get constrained by by borders, maybe opening up that more so you can actually get to some of those cross-state care. And really, it's going to be tough to get, physicians and staff into some of those rural areas for sure.
Yeah, I think your point, Kevin, we're going to see a big explosion of telehealth services within the rural areas, and support from larger systems, with some of those merger consolidations and affiliations as well. And as the rural markets really start to focus in on who they're going to be in the next stage, I think we're going to see them move into just those core services that the rural facilities need,
right,
with support from the larger systems on having telehealth access to specialists that they really can't bring to their areas. And if you think about the cost in some of the markets of having a specialist drive 3 or 4 hours, to a hospital to see 2 or 3 patients, is that the right solution, or is there a way for that specialist to get the same results through telehealth? And
right,
clearly there are some where yes, it is.
yeah,
There are some areas with no, but I think we're going to see more creative options with that, with support from the on-site team and, the resources of the providers off-site.
yeah, absolutely.
And within the regulatory environment for AI and governance, I believe that's going to be a huge topic in 2020 and
Yeah,
beyond. And even more important is, how do these organizations make the decisions with AI? Right now, if you're looking for AI, any type of, situation, if it's revenue cycle or, it's your supply chain, there are literally hundreds of
yeah,
companies out there. And, I think healthcare executives become overwhelmed very quickly with the amount of solutions. So being able to have an environment where someone's directing you to the 3 or 4 AI solutions that will make the biggest difference for your hospital or healthcare system, I think is going to become more and more important as we move forward.
yeah, I agree with you. It'll take time to. I think you got to be careful and not just jump all in. I know that, we talked about making decisions based on speed. I think that's good to realize you may need some additional, software or AI solutions, but you got to find the right ones and make sure you've done a lot of the, the risk assessment there. And you're right, you got to have those governance policies in effect before you start implementing some of that AI-based software and everything too. And I think there's more education that needs to be done, and I think we're lagging a little bit in the healthcare space on that, but I think we can hopefully get there over the next couple of years.
We're definitely going to get there. And I think there's some easy fixes too,
Yeah.
for leaders to develop out the mission vision that their hospital has for AI. How are we going to use AI? What are our philosophies around it? What solutions are going to be best for us? And tie it into the strategic plan. And if you can tie your AI strategy and governance into the strategic plan and use it for things that are going to move you forward and help you achieve your targets and your goals, now all of a sudden it becomes a lot easier to make those decisions.
Definitely.
Kevin, we have talked about a lot today, but I am sure there are topics that are on your mind that we have not covered. Is there anything else that you were thinking about or that's on your mind right now that we haven't asked that you'd really like to share with the audience?
Yeah, I just think it's an interesting time. I think one of the big topics that's kind of out there a lot is, what is private equity's role in healthcare, and is it positive, is it negative, is it somewhere in between? For me, I think it's somewhere in between, and depending on where it goes, and I talk a lot about this, and this is my version of it, not my firm's opinion on it, but this is my own opinion on it because I do work with a lot of private equity firms and whatnot. And I think there's a lot of good that can happen from the investment that come in there and from combining some of the companies from a kind of scaling up the back office functions. And I see that really works well in health tech and med devices where you're doing the research and putting it together and commercializing a lot of projects. The risk that I see, and we've seen it over the last couple of years, and especially even in Pennsylvania, you saw some of the private equity that got into the provider care space, actually the hospitals and the long-term care. You've had, a large bankruptcy this year, and you get into, well, why did this happen? And you see a lot of it with kind of some of the real estate that's involved and coming in, and you've got some conflicts of interest. You've got related parties that come in and they sell the real estate to another related company, and that's where all the value is, and they don't put that value back into the operations of the organization, and then it starts falling behind, and you see those cracks. I've seen a lot of private equity firms take their investments out longer than they used to, which I think is good for in the healthcare space. Is they're gonna they have a lot more, I think, tolerance now to invest and get that return, but over a longer period of time, and hopefully build it correctly. So I think if it's scaled right, but if you're looking at private coming in for a couple of years, then trying to resell it, I really have a lot of concern about that from the patient care. Other things I think is good. It's just really trying to make sure there's maybe some regulation more around it. I think there was a push in prior administration to have some sort of guardrails around it and to make sure that it's done right. But I think there's a place for private equity for sure, but also I think needs to be some regulations around, especially when you're in direct patient care as well too.
Yeah, I absolutely agree with you, Kevin. Along the lines of the guidelines and the guardrails that need to be there. And I think, as a hospital healthcare organization, if you're looking for, who your partner is going to be, always being innately focused on the intentions. What does the other party want out of this relationship? What are their goals? What are they hoping to achieve? And if it's just that quick flip of that money, within 2 to 3 years,
Yeah.
I'm not quite sure that, hospitals, healthcare organizations are the right solution when you're looking at Medicare, Medicaid dollars, government
Right.
funding. It can get very sticky very quickly. So understanding who's going to be here for the best interest of our community, who's going to help us. And there's definitely a point for private equity in healthcare, but there are also a lot of bad actors, to your point. So making
Absolutely.
sure who you're going to, attach yourself to long term makes a big difference.
Yeah, and I think talking to some of the private equity sponsors, over the last year, there's I think they also recognize that they don't want to be involved with a lot of the reimbursement or government payers, so they're stepping back a little bit more from where they are getting directly reimbursed from Medicare, Medicaid, and staying in other areas where it be med spas and surgery centers where there's more private pay. So I think they're kind of staying a little bit out there. Although I see, again, we talked about telehealth. A lot of behavioral health telehealth companies are still kind of coming together, and I think that's more of a play that they're seeing. That's kind of the future. So I think they're trying to get in right now and ramp that up as well too. But for right now, I think we're still seeing more of the investment in where they're getting the biggest return for their dollar in these more private pay areas, more of those types of services. So
I think that's going to shift some things too, where there's a lot more for-profits that are collecting cash from private paying clients to just run labs that are outside of the traditional insurance. So I think it's going to be a very interesting few years.
So I agree with you too. So
if our listeners would like to connect with you, Kevin, or reach out to Centri, where should they go? What would be the best way for them to connect with you?
Yeah, I'm on LinkedIn for sure. Can find me there, and I do stay fairly active there. But also too, you can go to centriconsulting.com, and then also reach me via email at kdady, Dadey at centriconsulting.com. Thank you, Stephanie. This was a great discussion. I really enjoyed it. Good to talk though, and kind of give my opinions on where we see things. I don't think anybody has all the answers, but I think we have some maybe expectations or predictions, and we'll see what happens.
Yeah, what I know is that together we are better, and it's not going to be one person that finds the solutions to healthcare in today's environment, but the collaboration of all of us together will lead us to the right results. So Kevin, thank you again for being on Beyond the Benchmarks. Your insights that helped us connect strategy and finance, and talking about the private equity space was really important. This is
Excellent.
More of what healthcare leaders today. And for all of our listeners, we look forward to seeing you on the next episode of Beyond the Benchmarks.